Manipulation under anesthesia is a simple, effective, gentle way of treating patients who haven't responded well to conservative therapy in the past. The history of manipulation under anesthesia dates back 60 years and is accepted in the medical communities. It's a viable alternative to patients that haven't responded well to conservative or traditional care. Manipulation under anesthesia is one of the most effective, gentle ways of treating a patient with a chronic condition while gently sedated, effectively and safely.
MUA stands for manipulation under anesthesia. We more often like to call it stretching under sedation, because that's really what it is. 95% of the procedure that we perform is stretching. And you may ask, why does a patient need stretching? Very common after a traumatic injury, such as a car accident, whiplash injury, slip and fall, scar tissue forms within the muscles deep inside your body, within the muscles, within the ligaments. If you ever get a cut on the outside of your body heals that with a scar, and everybody's had a scar before. When you have a traumatic acute injury, that same scarring happens inside your muscles, inside your ligaments, and eventually prevents a body part that's injured from moving the way it should. That scar tissue also acts like little splinters inside the muscles, which cause pain, sometimes long-term chronic pain. So stretching under sedation or manipulation under anesthesia is a very gentle, very precise procedure to very slowly release any scar tissue that has formed as a result of a traumatic injury. Many people ask, how does this work? Will I get hurt? Will you stretch me too far? We only stretch the body part to its normal range of motion and never beyond that. So therefore, there's no chance of injury by going past that joint's range of motion.
Generally, patients who we might consider to have manipulation under anesthesia would be patients suffering from a number of different conditions, anything from headaches, TMJ, neck pain, mid-back pain, sciatica, frozen shoulder. If a patient has been undergoing conservative care for a 6 to 8 week period and the results are not as expected, at that point in time, our staff would consider the patient for this procedure. Other types of patients who may also be considered for MUA include patients who have undergone a series of epidural injections who still suffer from pain, patients who may have undergone surgical procedures who may have developed scar tissue as a result of the surgical procedures, and those patients also may still be in pain. The MUA procedures is a safe, effective, and gentle way of helping those patients achieve the gains they intended to gain using the other procedures.
Manipulation under anesthesia is performed in an outpatient surgical center by highly trained specialists certified in the MUA procedure. The anesthesia portion of the MUA is performed by a board-certified anesthesiologist in the state of New York. The MUA procedure is performed by either a doctor of chiropractic, an osteopathic doctor, or a medical doctor who are highly specialized in the MUA procedure.
The results of manipulation under anesthesia are decreased pain, increased range of motion, increased activity of daily living, decreased medication use, and a healthier, happier lifestyle for patients. We find an efficacy of approximately 85 to 90% with most patients, which is very rewarding for us as practitioners. The screening process for manipulation under anesthesia allows us to safely and effectively choose the right patient base to do this procedure on. First and foremost, we go through a MUA screening process to make sure that the patient is a candidate for manipulation under anesthesia. After we carefully select the patient, we put them through a medical screening process, which is done to make sure that the patient can undergo anesthesia safely. We do blood work, EKGs, x-rays as necessary, review the MRIs, and make sure the patient is comfortable the day that they receive the procedure.
I think the mechanism of action of MUA is breaking up scar tissue, releasing nerves that are entrapped and muscle that has been chronically hardened from chronic injury. And there's no doubt in my mind the procedure works in 99% of the patients.
Other types of patients who may also be considered for MUA include patients who have just so much pain and they're so acute from their accident or injuries that in the office setting we can't often do a traditional conservative chiropractic treatment. Doing these manual therapies and conservative therapies while the patient is under twilight sedation is often a better and more effective way of achieving the goals we had hoped for in a conservative office setting.
After completing the post-MUA rehabilitation program, it's very common that our patients say to us, hey, I can play ball with my kid again. Hey, I can bowl again. Hey, I can enjoy hiking again. This is what makes it rewarding to us as practitioners.
During this procedure, we use only twilight sedation, which allows us to keep the patient readily available to get the procedure done within a probably 6 to 10 minute window. After that, the patient gently comes back to the recovery room and can go about their day as usual with great benefits from the procedure given that day.
You'll find that when you schedule an appointment with our office, you'll be greeted with warm, kind, caring staff on the other side of the phone. You'll schedule your appointment, usually the same day. You'll sit down with the doctor in the privacy of the room, go over your conditions, your problems, see if we can help you. Once you're in the consultation with the doctor room, he will determine if you're a candidate for the procedure or not. Once all of your questions have been answered, our staff will walk you through the procedure.
Our practice is located in Melville, New York and Ronkonkoma, New York. We have a great success rate with just conservative care with our patients and taking care of them as traditional chiropractic practitioners. However, for the small percentage that don't respond typically to chiropractic care in the first 8 weeks of care, 10 weeks of care, this is a perfect fit for them.
We're extremely passionate about our patient's care, and using manipulation under anesthesia has really given us a new option for patients that gives us great results and that makes our job even that much more rewarding.
As a practitioner, I can't tell you how rewarding it is to see a patient who's been achieving no results after a course of 6 or 7 or 8 weeks of care. I can't tell you how rewarding it is to see a patient come out of the procedure after 2 or 3 days and have amazing results.
We're talking about patients in which everything else has failed, and they have chronic pain on a scale from 9 out of 10. And to take a pain scale of 9 out of 10 and knock it down to a 1 or a 0 is very rewarding to the physician and the chiropractor. So we look forward to treating many, many more patients and letting the world know that manipulation under anesthesia exists. You will hear success stories from many, many patients, but there are hundreds more who couldn't be on this film, obviously. And I encourage you to look into the procedure.
I was in a car accident. I've hurt my back and my shoulder very bad. I was going to my doctor for several weeks, and my body wasn't working with the procedure he was giving me. So he thought that this procedure would be benefit for my health. I walked into this procedure, and I was really nervous to have this procedure done since I was in a lot of pain. After having the first day under the anesthesia, I got a little more comfortable with doing this set 2 times over. It's a fantastic procedure. I feel a lot better than when I walked in the first day. It's only been 2 weeks, and it's only getting better. After knowing what I know now about this procedure, I would recommend it to people that are in a lot of pain, like I have been. At one point, I couldn't lift my arm up too high, and now I can lift it up this high. So this procedure is a good procedure for people in very chronic pain in their back and neck.
Back in April 2012, I was involved in a motor vehicle accident. I was rear-ended, and it left me mostly unable to walk. I could pretty much just shuffle around, and I had to take a considerable amount of pain medication just to get around, just to get through each day. And I became a patient and for a chiropractic, and I ended up getting a manipulation under anesthesia. And after that procedure, I was able to move around and I was able to function like a normal person again without having to take medication all day. I mean, truthfully, most of the pain is gone, not all of it, but I can, tie my shoes, I can go to the bathroom, I can even, kayak and do basic sports and things like that. My life completely changed after that manipulation. And prior to that, I didn't think that I'd ever be able to do any of those things again. And now I can pretty much live a normal life.
In 2010, I had a hysterectomy that went bad. My doctor, she performed a procedure too far to the left and injured a bunch of nerves in my hip. That caused hypersensitivity to my left hip and a bunch of scar tissue that developed in my abdomen region. Basically what that did was it's choked out the nerves that went to my leg, and for years I walked around with my leg dragging behind me. I couldn't do a heel stand or a tippy toe. I couldn't walk, do stairs. The pain that was in my leg was excruciating. I don't know how I survived it. I really don't. And eventually I was told about a manipulation and anesthesia. And I went and I had one done. It was a miracle. What they did for me was they performed the manipulation, and when I was in the recovery room, I was terrified. I didn't want to move because I didn't want to see if I had success or failure. And when the doctors came in and they examined me, the first thing I could do and realized was that I don't have pain. I did not have any pain whatsoever. Then they performed different procedures to see what my level was as far as restrictions and rotation and movement. I was totally free of my restrictions. I got off the table, I could walk like a normal person, I could lift my leg, I could move in a way that I hadn't done in years. It was a gift. It really was a gift. I'm very much excited for anyone to try this. I think it's something that if you're in doubt, you should go for it, because I'm a prime example of why it should be done. And who should go for it? Anyone that the doctors feel needs it.
I was involved in 2 separate car accidents, first one being back in 2010, 9 months later being the second. I did have pre-existing conditions on my back and my neck, which were hurt in those accidents. I had back surgery due to those accidents, and then found out about the manipulation under anesthesia. After having the procedure done, being the MUA, I learned that the bulging discs that I had in my neck were no longer there. I only wish that I had known about this procedure prior to having my back surgery, because I honestly believe that I would not have had to have had that surgery if I had had that done first. I am one of the biggest advocates for this procedure. I tell everybody about it, and I highly recommend it to anyone who suffers from any kind of pain, any kind of disorder. After having my back surgery, I had found out that I was supposed to have neck surgery, which I was putting off, and then I found out about the procedure, and after the procedure, I then learned that I no longer needed to have the neck surgery, which of course made me very happy.
I came to get the MUAs after a bad spinal injury, multiple surgeries. I had scar tissue, weakness, found myself in a wheelchair for a couple years. Been through many a treatment, seen plenty of doctors, heard about the manipulation under anesthesia. Thought it was worth taking a crack at something else. And after the 3-day procedure, actually after the first day I felt some relief. After the 3 days, I felt mobility, range of motion was much better, and the pain was reduced significantly. And I'm out of the wheelchair, I'm sure not just because of that, but it was a big help, big turning point to getting me to where I'm at today. I was skeptical first coming into it because I've been through so many procedures where I didn't really get a lot of success. I was told by a lot of doctors not much they could do for me. So I always hope, and I hope that each treatment, everything that I try would work. So I guess I kind of took this with a grain of salt that this would hopefully do something for me, and was pleasantly surprised when I had significant help from it.
After an auto accident and years ago, I actually came to a center to see if I can get some help with stretching. My body was very stiff. I was unable to move the way that I used to, and I was concerned. My wife, children, everyone was concerned because, as you can see, I'm still a relatively very young man. My life had been changed. I met a doctor who suggested I try manipulations under anesthesia. Shortly after, it didn't take much to convince because the time in my life was very difficult right around then. So I went under and I did the procedure. Shortly after, after a short follow-up period of some physical therapy and muscle building, I felt like I was in high school again. all of a sudden I was able to do things that I was unable to do before. I'm a pretty large man. I was able to bend down and put my palms flat on the floor. I started to feel a little more invincible, and I began working out, and then within 3 months I dropped 74 pounds and started working out, and from there my life has been changed. That was approximately 3 to 4 years ago. I haven't required or needed anything since then, and I feel I'm back in control of my life. I'm able to do things with my children that I was unable to do before, and at my age now, I'm actually 20 years younger than I was before the procedure.
I had gotten into 2 car accidents back to back within a week. The first one I hit a deer, and the second one, when we had the 4 feet of snow, somebody rear-ended me going 60 miles an hour. I'm a registered nurse, and I was coming home from work. Anyway, the second car accident changed my life. I was going to a pain management doctor, and I had several epidurals. I was prescribed opiates, and nothing really helped the pain that I had, and I was currently walking with a cane. I was unsteady on my feet. I had headaches. I had chronic neck pain. I couldn't turn, when I was driving, I couldn't turn my neck to see, to look to the right or to the left. I had difficulty sleeping, and I had severe pain in my back, and the pain specialist doctor had referred me to manipulation under anesthesia doctor that I had met. And to be honest with you, I was kind of skeptical because I had never heard about it, and I was like, well, what do you mean I have adhesions? What do you mean I'm going to be sedated and you're going to, break up the adhesions? But I went along with it because I was desperate. I was depressed. My whole life had changed. I was a very independent person. I was in the process of trying to get my master's degree. And like I said, I had problems ambulating, I had problems walking, and I was miserable. So I had the procedure done, and within 2 weeks after I had the procedure done, I didn't have to use the cane anymore. My balance came back. I have full range of motion, you could see, of my neck, and they broke up the adhesions. So I would highly recommend the manipulation under anesthesia to anyone who has had any type of trauma to their neck or to their back.
I've suffered from fibromyalgia for about 25 years, and if you know anything about fibromyalgia, it can be very restrictive in terms of your movement. When you have a flare-up, it's very restrictive. You have a difficult time doing day-to-day activities. And as I was getting on in my years, it was getting worse and worse. And I was having a difficult time doing mostly anything. I've always been a very active person. Part of taking care of yourself when you have fibromyalgia is exercising every day. Otherwise, you really end up in a lot of pain. So I was getting to the point that my muscles were so tight, and the burning sensation that you get in your muscles from fibromyalgia was getting to be so debilitating that I couldn't exercise at all. And it was becoming difficult to even sit at a desk for a long period of time, or stand up for a long period of time. If I had a project to do and I had to stand for it, I wasn't able to do that. And it was getting worse and worse. And my chiropractor recommended manipulation under anesthesia, and had told me that it was very successful with a lot of other fibromyalgia patients. I had been seeing this chiropractor for most of my life, and he had always been very helpful to me, and I trusted him implicitly. So I was not frightened to do this. I was very confident in his suggestions, and it was not painful. It was really a piece of cake. You went in for 10 minutes for three consecutive days. By the third day, when I came out of the anesthesia, all of the burning sensation was gone. I was able to exercise within about 5 days. I was able to go into physical therapy, which is part of the aftercare, and had no problem lifting my leg all the way to my shoulder. It really did a lot for the problems that I had with the fibromyalgia. I would recommend it to anyone who has fibromyalgia. It gave me tremendous relief.
For years, as an adult, I've suffered from daily chronic migraine headaches, or just daily headaches that didn't go away. And it was my physician who mentioned to try it. And I said, I've never heard of it, what is it? And he said, basically, you go to sleep for 15-20 minutes. When you wake up, the procedure is done. You do it 3 days in a row, and hopefully there'll be results. Not fearing to lose anything, because I've tried every other medication there was known to mankind, and nothing was helping my headaches. I said, why not? So, for the next 3 days the following week, I did the MUAs, felt nothing, woke up 15-20 minutes later feeling basically refreshed. And by the 4th and 5th day, I noticed my headaches weren't as pronounced, as severe, and as the days became a couple of weeks, the headaches disappeared completely. I was shocked, and I was truly impressed. That said, I think that MUAs can be worked for anyone. I also had back pain, and which also disappeared, which I wasn't even thinking about at the time. But I've got to say that I would recommend it for anyone who has any kind of body aches, pains, muscle pains, back problems, and of course any kind of headache or whether it's related to physiology or stress. I believed in it. It was painless. And it was wonderful. I have no problems since then, and I would recommend it for anyone.
I had come to get treatment for 2 car accidents that I had been in. That was almost a year ago now. I had the manipulation under anesthesia procedure about 4 months ago. It was life-changing. Before that, I had bad range of motion, difficulty moving, trouble sleeping. Getting in and out of bed and in and out of the car was trouble. After the procedure, which went very quickly, the procedure helped me get the range of motion back that I wanted. It helped me, get treatment that I didn't think that I was going to even be able to. They had spoke about back surgery prior to that. And after having the manipulation under anesthesia, I don't need back surgery. So it's actually been a great success. And I look forward to the rest of my life.